Hello, and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician, and in Aging in the Brain Part 1, I discuss the normal changes that occur in our brain as we age. Today, I'll be discussing Aging in the Brain Part 2, Preventing and Managing Dementia. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. You may remember from our Part 1 this graphic of the trajectory of brain function with aging. You may recall that normal elderly functioning includes things like senior moments. These can be distressing, but they are not serious. That can progress on to mild cognitive impairment, or MCI, which are more senior moments that become more distracting, but they don't interfere with your daily function, with the activities of daily living. However, if you do develop sufficient cognitive impairment that interferes with your activities of daily living, that grades into dementia, and that can proceed into moderate and severe dementia. Keep this graphic in mind. The definition of dementia is a progressive disorder with cognitive decline from a prior level of functioning. It involves one or more cognitive domains like memory and executive functioning, but importantly, it interferes with independence in everyday activities. And that's the most important difference from mild cognitive impairment, or MCI, which does not interfere with daily activities. There are several types of dementia. The most common is Alzheimer's disease, and that's the type of dementia we'll be talking about mostly today. However, there's also vascular dementia, there's frontotemporal dementia, there's dementia with Lewy bodies. There's also combinations of Alzheimer's disease with vascular dementia and Alzheimer's disease with Lewy body dementia. And then finally, there's a group of other dementias like Parkinson's disease. The risk factors of dementia are important. The strongest risk factor is age over 65 years. But family history is also an important risk factor, as are chronic diseases like high blood pressure and diabetes, and cerebrovascular diseases like TIAs or strokes. An unhealthy lifestyle, such as smoking or excessive alcohol intake and sedentary behavior, are also risk factors for dementia. And medications, especially anticholinergic medications and benzodiazepines like Ativan, are risk factors for dementia. The diagnosis of MCI and dementia, first and most importantly, depends on a history and physical by your healthcare provider. This would include a medication review and a review of your chronic diseases. It would also involve a collateral interview, that is, interviewing a spouse or children, and determining the impact of the symptoms on your activities of daily living. Also, a review of other possible diseases like depression and delirium, which can sometimes look like dementia. Lab tests are often performed, although they're less useful. Blood and urine tests, and commonly MRI or CT scan or a PET scan. Diagnosis of MCI and dementia will also include formal cognitive assessment with tests like the mini mental state examination or the Montreal Cognitive Assessment, and sometimes extensive neuropsychological testing by a neuropsychologist. There are several home screening tests for MCI and dementia that you can administer to yourself. They are easily found on the web and in books about dementia. Some of them include the AD8 or the Instrumental Activities of Daily Living Scale, the Mini Mental State Examination, or the self-administered Cognitive Exam. These self-administered tests are not recommended unless the cognitive impairment affects your activities of daily living. Once again, we see this trajectory of brain function with aging. And the question now is, how can we prevent and manage the trajectory of normal elderly brain changes, mild cognitive impairment, and moving on into dementia? Vitamin and mineral supplements are heavily advertised for preventing and managing MCI and dementia. Vitamin B complex plus folate combinations probably don't offer any benefit. The research is clear that vitamin C, D, and E offer no benefit, and other minerals offer no benefit either. Other nutritional supplements like resveratrol and Prevagen have no scientific evidence of significant benefit in preventing and managing MCI and dementia. As far as medications for preventing and managing MCI and dementia, there's no clinically significant benefit. Recognize that when we talk about clinically significant benefit, that's what the patient and the family would notice. Oftentimes, researchers will find some statistical benefits, but these do not translate into clinical benefits. So we see no clinically significant benefit for the cholinesterase inhibitors like Aricept and Razidine and Exelon, nor for memantine, Namenda, or the amyloid and tau removers. These are the new kids on the block that are causing a great deal of excitement that seem to remove the amyloid and tau tangles that are found in Alzheimer's disease. They're very expensive, and all of these drugs have significant side effects. But once again, despite all of their popularity and hype, they do not offer clinically significant benefit in MCI or dementia. And in fact, a report from the American Academy of Neurology is quoted here. There currently are no medications or dietary agents shown to have symptomatic cognitive benefits in patients with MCI, and there are no FDA-approved medications for MCI. And as far as medications, the bottom line is here quoted from a review published online July 31st of 2023. At present, drugs for Alzheimer's disease have unproven clinical benefits and proven harms. Billions of dollars spent on hearing aids, smoking cessation, encouragement of healthy lifestyles, and treatment of hypertension, diabetes, and other modifiable risk factors may benefit patients more than spending on these drugs. So medications won't help to prevent or manage MCI or prevent the progression to dementia. But what can help is to challenge yourself. For example, lifestyle changes have been shown to benefit MCI. That includes controlling high blood pressure, eating a healthy diet, in particular a Mediterranean diet of whole grains, vegetables, legumes, fruits, nuts, seeds, olive oil, fish, and seafood, with dairy and poultry in moderation, and red meat and sweets only occasionally. Don't add salt to foods has been found to be beneficial. Limiting alcohol use. Don't smoke. Do take naps for 20 to 30 minutes once or twice a day. Get 7 to 8 hours of sleep each night. And new research is showing that hearing aids and glasses and cataract removal, if necessary, can help to manage MCI and prevent the progression into dementia. And also, because medications can cause symptoms of dementia and MCI, it's important to discuss your medications with your health provider. Intellectually engaging activities have definitely been shown to help manage MCI. And that includes simple things like puzzles and discussion groups and reading, writing for pleasure, calligraphy, painting. Using the computer and internet actually decreases the risk of developing dementia by 50%. But games like cards and board games and listening to music are beneficial. Participating in music is even more beneficial in preventing the development of dementia, like singing and playing a musical instrument. And also employment, and that would include volunteer activities. Physical activities are also important in preventing and managing MCI, specifically exercising individual exercises like walking and stair climbing, exercise machines and swimming, gardening and dancing, and group exercises like Tai Chi, Qigong, and yoga. Crucial to maintaining cognitive function and preventing and managing MCI is social activities. That includes travel and cultural events like symphony and opera and museums, but importantly, socializing with friends and family. But also, benefits come from taking a class or joining a social center like a senior center. I mentioned volunteering, but also attending religious activities and participating in discussion groups. These all sound like wonderful things to do and lots of opportunities to help to manage MCI. Where can you do all of this? Simple. At your nearby senior center. Senior centers generally offer many of these exercise and intellectual and social activities that I've described. And I urge you to check into your local senior center to see what's available. Also, memory helpers can be very valuable. Plan tasks in writing. Write out the steps of your task. Even if it's a simple task, write out the steps. Writing them, putting them down on paper seems to be very important to stimulating the brain. Make to-do lists. Make a new to-do list every day. Cross off what you haven't done and what you need to do next, put on the list. And use memory aids like notes and calendars. These memory helpers can be very, very useful to help you maintain daily function, which is our whole point. Other memory helper is your smartphone. Smartphone apps, especially using voice commands for calendar, to remember appointments and to make your to-do lists, to make other reminder notes. And I recommend to my friends that they text or email themselves with reminders and notes of things they want to do. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.